Okay, next we're going to do observation of the shoulder, and for this one, obviously we would kind of watch the patient as she would walk into the athletic training room or the clinic where you might be, just to see how her shoulders are bilaterally, to see the swing, or if she might be carrying her arm, if it might be injured, that might be indications for some type of an injury. They also call that guarding, or she might be favoring it in some other way. We also want to make sure that we look at the position of it, to make sure that, anatomically, does she have rounded shoulders on both sides, or again, if not, you might be observing for any swelling, inflammation, redness, or deformities in the shoulder area. Anteriorly, we can also look at the clavicles and the various joints, the sternoclavicular joint, coronoclavicular, corticoclavicular joints, and the glenohumeral joint. Obviously, we would all observe on the patient anteriorly. Again, just looking for symmetry. And then I'm going to have you turn around, Jessica. And then posteriorly, again, we can look at the spine of the scapula, and then the scapula itself, the scapular borders we can look at. And again, maybe to help see it, we might have you go ahead and put your arm behind your back and grab it, and then just kind of push against it, and that might help define the scapular borders a little bit, and maybe even some of the rhomboid muscles a little bit easier. Okay. Now we also want to make sure that we're looking at the humerus as well, maybe from the lateral view or the other views, especially as it gets closer to the joint. The musculature, the deltoid is another thing that we want to look at. The rotator cuff muscles and the latissimus dorsi, and go ahead and turn anteriorly. Another thing that we may look at anteriorly is maybe the pectoralis muscles and maybe the sternocleidomastoid muscles.